Hi, Amy here. Hope you're well. Now, as you know, I love doing a little bit of a tutorial video or telling you what's going on in the nail world or what conditions are out there and how to spot them and what to look out for and all of that jazz. Now, the condition that I want to talk about now is called onycholysis. Onycholysis is actually a really common condition that you find in the beauty industry. It's really hard to call it onycholysis because I've always called it onycholysis. I've been in the industry over 25 years and I've been calling it the wrong name, onycholysis. But you know when you've got something in your head that you just can't rectify because you've been calling it that for so long, onycholysis. So it's really common, unfortunately, but I wanted to explain what it is, why we see it and what we're going to do about it. Now, onycholysis is when the nail, the nail bed, the base of your nail, the skin underneath and your actual nail plate lift and separate. Now, there's a picture here for you so that you know what it looks like. For anybody that's had extensions or gel nails, you may have seen this or you may have seen it on friends or family. It can be quite common. Now, there's so many reasons why this happens. It's not just one size fits all, unfortunately. Now, the main reason that you would see onycholysis is to do with trauma, nail trauma. So people that tap loads, type hard and fast. It's when you can sometimes get it, if you've got it on one nail, it's probably because you've knocked it or caught it at a door or something. Basically, any kind of trauma to your nail bed can cause this little gap between the bed and the nail, and then the nail lifts. Once the nail lifts away from the nail bed, it will not rejoin, but it will grow out. So please don't fret if you do see this. Your natural nail will adhere to the nail bed as it grows out. But once it's knocked, if you've got that white, sometimes you get white spots if you've knocked it, that can be a sign of the start, and sometimes that will spread. Now, the thing is with onycholysis, it actually looks exactly the same as psoriasis and sometimes even eczema. So if you suffer with psoriasis or even eczema and you find that your nails are separating, it can be that the psoriasis is under your nail plate. It looks exactly the same, like I said, as the picture that I showed earlier. Now, also there's certain medications, chemo treatment can cause it. Any kind of immune suppressants can cause it. You've got alopecia that can cause it as well. There's loads of different, like I said, medical conditions that can cause the separation of your nails. So it's really, really important that we get to the bottom of it and we help you figure out what it is. But also, on the other side of that, there are types of nails, like nail types of treatments that can also contribute to this. So if you think of your hair, I bleach my hair. You would never know, would you? So I bleach my hair. Imagine if I bleached my hair every 3 weeks and then expected it to not fall out. Same as lash extensions, right? So it's all the same, keratin. Now, I have a real problem. I've got fair hair, fine hair, and I can't hold lash extensions. I have had every type of lash extension going and my lashes always snap off, no matter whatever glue is used. I've had them done 5 times by different techs with different products, all saying that theirs will be fine. But my lashes will always snap, and they will snap quickly as well. I use those cluster lashes, the Amore ones. I love them, but my lashes, they're meant to do no damage whatsoever. My lashes will always snap. I have bendy nails. I have fine hair. So if I wear gel for too often, then I will get problems. My nails will become very thin, or I will get onycholysis because my natural nails can't hold the product. So it's exactly the same. Now, what we need to do is figure out what nail system works best for you. That's our priority. Our priority will always be your natural nail health. So the reason we have implemented the 3 infill rule is because we want to take off the product and check your natural nail health. If we are seeing any signs of onycholysis or greenies or anything like that, we want to take the product off and then help your nail adhere to its nail bed naturally again. There's different things that we do in the salon that prevent this from happening as much as possible. However, the products we're using for gel products are still chemicals. It's still like bleach. It's still like glue. You know, these are all things that are chemicals. Some people can handle it and have them done over and over again and not have any problems. Some people can't. And it's our job to make sure that we get to the bottom of it, find out, make sure it's not a health condition, first of all, that's underlying, that the nails will show. Or if it's a problem with the product, maybe the product's too tough for you, maybe it's a little bit too hard. For instance, some people find the builder gel a little bit too hard for their natural nails, and it can make them a little bit bendier. If that's the case, then you just need gel manicures, and it's down to us and our Mooeys to make sure we find the right treatment for you. Now, a lot of people will put it down to the HEMA, which is the acrylate that's in the gel bottles product. HEMA is more of an allergen. This isn't an allergy. However, if it's not managed or monitored, it could lead to an allergy. Just like anything, people can become allergic to anything randomly. If your nails are thinner or weaker, then it could lead to an allergy if we're not careful. Hence why we'll always have a look. So what we want nowadays is we want products that last forever and that are harder, so we get 3 weeks wear out of them, 3 or even 4 weeks. We have some people that try and push it to 5. Now, it's not good for your natural nail to keep a product on that long without checking the health of it. And I understand that, you know, we're paying for a service, we want it to last as long as possible, but there is finding a happy medium where we're not keeping a product on for too long, we are checking the health of the natural nail, we're making sure everything's okay, everything's tickety-boo, and then we can carry on with another application. That's our job in Mooeys, and we really, really care about that. We really care about the health of your natural nail. So, 3 infills, please make sure if you've had 3 infills, the next appointment you book is a removal and reapplication. If you're finding that you're sensitive to any products, if you're finding that the light is a bit strong, you know, sometimes you put your hands in the light and it can get like it's called a friction burn, but you can feel that tingling or that burning sensation. It's really important that you tell your Mooeys if you are having anything that doesn't feel right. We have different settings on the lamp, and if that lamp is too high, it can cause trauma to your nail, which we don't want, okay? Now, the gel bottle has got HEMA in. It is an acrylate. It is a chemical. Most people can handle HEMA and it's not a problem. Some people will develop an allergy to HEMA. Some people will never have a problem. Some people can never use it. Everybody is different. We do have HEMA-free polishes in the salon, although we don't find that they last as long because the HEMA is what keeps the gel on your nails. So if we're looking for a 2 to 3 week time frame of product lasting on your nails, we need to find the best product for you to make it last as long as possible. The longer a product is on, the more damage it can cause. So we just need to find that happy balance. Now, when you see onycholysis, sometimes, only sometimes, it can lead to a fungal infection. The reason for this is that your natural nail plate and your nail have separated, so there's a gap. Now, you can pick up a fungal, you can take it from feet to hands, which is really the most common. So if you've got like a tiny bit of athlete's foot, you scratch your foot and it's under your nail, as an example. You can pick up any kind of bacterial, fungal in changing rooms or communal spaces or whatever, and sometimes it can just get trapped, and because it's a small gap underneath, it can just be a breeding ground. The only way that fungal nail infection is actually diagnosed is if your doctor takes clippings of your nail and sends them off for testing. Some doctors will just automatically prescribe medication so that if it is fungal, they get it. Some people will send clippings, but it's really difficult to diagnose fungal. So a lot of GPs would rather diagnose it, because if it's not fungal and it looks fungal, then it might be psoriasis. So you want a doctor that's curious, really, that can help you get to the bottom of it. But most important thing for us is that your health is fine and that your nails are not showing any sign of some other underlying health condition. So please make sure that you book your removal after 3 infills maximum, okay? And then we can do our job and help make sure we're nurturing your natural nail. I hope this helps when it comes to onycholysis. If you have got any problems, please let us know. For those people that have had nails on for a very long time and we're in that process of taking it off, sometimes we will see something, but that's what we're doing it for. We want to see if there are any complications. Thanks very much. As always, if you've got any questions, give us a shout and have a read of my blog. So let me know what you think. Bye.